Hi, I'm Prianka Evangeline, your internet speech language pathologist, and in this video, I'm going to tell you the top 6 things you should know if your child has recently been diagnosed with autism. If you are a parent of an older autistic child, then let me know in the comments on what you wished you knew the first time you got the autism diagnosis so that it can help the new parents watching this video. Before we go into the 6 tips I have for you today, make sure to like this video and press the subscribe button, also the bell icon. We have all been taught this phrase of settle down, meaning study really well, get a good job and then get married. That's all. There are no more challenges after that, and this means that a life after this is going to be smooth and no difficulties. But now you know that that is not the case. So it's not your fault for thinking like this, but it is how we were all taught that this is the progression to follow, and after this life is going to be very happy and blissful. But that's not the case, right? So try to change your mindset from this feeling that everything has to be this way. I have set these criteria of how my life should be, and whatever happens has to fit in this criteria. So try to let go of that fixed mindset and try to shift to a growth mindset. So a growth mindset signals that whatever happens, whatever challenges I am having, whatever new things that I have to learn or new things that I have to adapt myself to, I will do it. I am capable of doing this. So try to go from a fixed mindset to a growth mindset. It is difficult for me to tell you what to do, but might have created your vision of how your life should be. And now you have a diagnosis that changes many things. So instead of trying to change your child, mold your child to fit into your vision, try to maybe modify your vision. Take a marker, erase certain things, keep it clean for your child, and now whatever is your child's capacity, now put that on the board. So try to change and tweak your vision a little bit with the growth mindset. Self-talk is what we talk to ourselves in our mind. You might have heard this, that we spend most of our life inside our mind. We have to make sure that the mind is a good place to be. Our mind is a happy place for us to be. Anytime you are alone and you are always plagued with negative thoughts and all, thoughts about what is going to happen, I'm doomed, if these things keep coming up in your mind, it is not a good place for you to relax or to be. So try to change that. I am giving you some options here. So go from a victim mentality to a victor mentality. So a victim will think, oh no, this happened to me, I am to blame, I did not take these supplements during pregnancy, or I did not do these religious rituals, that's why this happened, or I did not do this. Stop blaming all people, yourself, other people. Stop blaming them and thinking like, why did this happen to me? Why me? What did I do? Change all these thoughts into a thought like, I can do this. Okay, this is a challenge. This is a responsibility given to me. This is something demanding of me. I will step up to this challenge. I can help my child. My child is not broken. My child is not having a disease or anything. I can help my child, because the fact is, neurodiversity, that is different types of mind, is present in so many people that it is so common. 1 in 7 to 8 people are neurodiverse. But we don't show that out, or they don't easily talk about these things because we have a social stigma that we might be stigmatized or we might be left out of the group. So we don't tell people these things. But in fact, we might be neurodiverse and we'll do these things that make us happy in private, but we will not show it among our friends or our family members. So that is something called autistic masking, or that is a whole different topic. But the fact is that this happens in many people, and neurodiversity is a biological fact, and it is how it is. You cannot change this, because this is how the brain evolves. This is how the brain functions. There are various types of brain. There is no one type of brain. So it is not something you did that caused this. And if you hear of therapies trying to change your child and fix your child, then that's not going to help much, because you're trying to change something that is not just part of your child, but it is your child. So autism is an identity. Autism is not a disorder or a disease, but it is how the brain is and how the neurology of the child is. So it is not something that you have to blame yourself for, but instead you have to change your victim mindset to a victor mindset and think, I can do this. This is a challenge, yes, but I can step up. I am going to find the tools to help me. I'm going to find the people to help me. I'm going to build a community of support around myself to help me and help my child. I'm going to teach my child the basic essential life skills that school sometimes doesn't teach. So these are the thoughts that you have to shift to from your victim thoughts. Now, you might have already started doing this. That is, you go to Google, you type autism, and you read a lot of information. There is so much information, right, about autism. So, how do you distill the information? That is, information, how are you disseminating this information? Are you taking it from the right sources? How to find this? I'm going to tell you. First thing is to go and find the author of the blog or find the author of the article and see what is their degree. Do they have enough experience? Are they talking from a place of honesty? That is, are they trying to sell you something through that article? If they're trying to sell you something, then that's not the best person to tell you actual facts. So if you can answer these three questions, that is, what is their degree? Are they experienced? Are they relatable? Are they telling you things that you can understand? And the third thing is, are they trying to sell you something? Next, now when you go on Google and you search for all this information, I'm going to give you a tip. Look at the website which has a .gov or .org or .edu. These websites are more reliable than a .com or a .in or a .net. So find governmental organizations, NGOs, educational institutions that do actual research and share that with you on their website, and look at these reliable institutions web pages. Some examples will be ASHA, that is American Speech and Hearing Association's website, which has a lot of information related to speech and language development and speech and language development in autistic children. A lot of parents I see, they assume that, oh no, this is just a phase, the child will outgrow it, this is nothing. These kind of thoughts are not going to be helpful, but I would suggest start somewhere, start some small thing, one therapy session a week, or one assessment, one doctor, go see somebody and start something, and don't just wait and don't be in denial. Because it is more, the being in denial and waiting is going to cause more lag than actually starting. And that's not going to do anything. It might cost you a few hundreds, but it's not going to impact your child's development, whereas waiting does impact your child's development. The fifth thing is that therapy works. Whatever type of therapy it is better than doing nothing. So start with therapy. There is something called analysis paralysis. That is, when you start reading about all these things, trying to find the right technique for your child, you have so much of information and you don't know how to make a good decision. You don't know what factors to base your decision on. So don't allow yourself to get into analysis paralysis, or even if you are there, start with therapy. Start with regular, consistent therapy. I always tell my parents, I know I look like an angel, but I'm not going to be able to do magic in just 40 minutes. So it will take time, it will take effort from all the family members, and it will take a lot of work at home also to teach your child. So there is work involved, and you should not spend most of your time doing this research and search, but more on actually doing. I see a lot of parents, you might be one, who see a lot of YouTube videos, so many suggestions, so many activities. They just keep seeing and then they go do some other work. Don't be that. See just one, don't be that parent. See just one video, any video, not just my video. See one video and immediately apply it with your child. Immediately apply it and immediately do a review of what you did. Did I do this correctly? Did I try this one? And talk to your therapist about it. I tried this strategy, this happened. What do you suggest? So make sure there is action involved in all of thinking. So don't just keep thinking, start doing also. So the sixth tip is you have to spend time with your child. Don't be the parent who just sends your child to therapy and expects the therapist to do all the work. And if you just send for 1 hour a day therapy, 2 hours a day therapy, he's going to develop, and you don't have to involve yourself. The truth is you have to involve yourself at least minimum of 1 to 2 hours a day, specifically for your child, at least 5 days a week. Keep this as a baseline. Every day I will spend at least 1 hour with my child, minimum of 1 hour. And in that 1 hour, I will be completely engaged with my child. So I will link my how to play with your child playlist over here. It has a lot of strategies and activities to help your child. If you don't know where to start, that's a good place to start. And start playing with your child by being fully involved with them and trying to make them happy and learn. And as you go to therapy, ask your therapist about what you should be doing at home. This is a very important concept that parents have to ask therapists, what are you working on? What is the goal for my child? What should I do at home? How can I help my child at home? Ask these questions to your therapist and get their suggestions and apply it at home. If you need some more information on how to choose a therapist, how long to go for therapy, I have a frequently asked question playlist that I will link here, which I go through like how to do diagnosis, what is the right age for evaluation, how to choose a therapist, how to know if you have a good therapist, all that information in the frequently asked question playlist. You can check it out. If you liked all this free information I'm giving you, try to help me out by sharing this video to some other parent or a parent group who might also find this useful. See you in the next video. Bye.